But during pregnancy, it completely transforms. It goes from being just a routine number at a checkup to one of the most critical signs of health for both mom and baby. So what exactly is going on here? Why does this one number suddenly carry so much weight?
And that's really the big question we're diving into. Because after a certain point in pregnancy, a change in blood pressure isn't just a number on a cuff. It's a signal, a potential warning sign for something much bigger. So let's get into what's really happening behind that reading.
You know, everything in pregnancy seems to follow a timeline, and managing blood pressure is no exception. There's this one huge milestone that completely changes the game, the 20-week mark. Before this point, it's all about looking ahead, about prediction and prevention.
So take a look at this timeline. You can really see how the game plan shifts. That first trimester is all about prediction. There's a really important window for advanced screening between 11 and 14 weeks, and an ideal time to start preventative meds before 16 weeks. And the reason for all this urgency? Well, after week 20, that's when we enter the zone where hypertensive disorders of pregnancy, or HDPs as you'll hear them called, can actually start to show up. The secret sauce here is something called multimodal screening. And let me tell you, this is way more than just wrapping a cuff around an arm. It's a much smarter approach. It combines things like maternal risk factors, blood pressure measurements, and even specific blood tests to create a complete risk profile long before any symptoms would ever appear.
Okay, so what if, despite all the prevention, blood pressure does start to climb after that 20-week mark? The term high blood pressure actually covers a whole spectrum of conditions, and telling them apart is crucial. So let's decode these diagnoses.
First up, we've got gestational hypertension. Think of this as the most, well, straightforward of the bunch. Your blood pressure goes up, we're talking 140/90 or higher, and it happens after 20 weeks. But here's the key part. There are no other signs that it's messing with your organs. It's basically a temporary spike that, thankfully, goes away after the baby is born. Now, preeclampsia. This is a different story. It's more serious. You have that same high blood pressure reading, but now it's bringing friends to the party, and not the good kind. We're talking signs of end organ dysfunction. This could be protein leaking into the urine, which tells us the kidneys are under strain, or maybe the liver enzymes are elevated, or you're getting severe headaches. It's clearly not just about blood pressure anymore.
So if you want to boil it down to the absolute basics, here it is. With gestational hypertension, the problem is just the high blood pressure. With preeclampsia, that high pressure has started to cause trouble elsewhere in the body. That little phrase, plus organ involvement, that's the game changer doctors are looking for.
And just when you think you've got it figured out, there are a couple of curveballs doctors have to watch out for. On one hand, you've got white coat hypertension. You've probably heard of this one. It's when you get nervous at the doctor's office and your blood pressure shoots up, but it's totally normal at home. But the one that's really sneaky is masked hypertension. That's where it looks perfect in the clinic, but it's actually high the rest of the time. And that's exactly why monitoring at home can be so important.
And this all leads us to a very simple but very scary equation. Eclampsia equals preeclampsia plus convulsions. If preeclampsia isn't managed, it can escalate to this. It's the same underlying condition, but now with the terrifying addition of seizures. And that, right there, is a full-blown medical emergency.
Okay, so because the stakes are this high, it is absolutely critical for clinicians to spot the warning signs that things are getting worse. And we're not just talking about how someone feels, we're talking about hard data, objective red flags that scream severe disease.
And these are the big ones they're looking for in the lab work. Low blood oxygen, that could mean the lungs are involved. Platelets dropping, that's a huge deal because you need those for your blood to clot properly. And then you see these liver enzymes or creatinine levels spiking. Those are like flashing neon signs that the liver and kidneys are really struggling. Each of these numbers tells a piece of a story, and it's a story of a disease getting much more serious.
And the reason they take these numbers so incredibly seriously is because they could be pointing to something called HELP syndrome. This is a particularly severe variant of preeclampsia. HELP is actually an acronym. It stands for hemolysis, elevated liver enzymes, and low platelets. It's a dangerous cascade of complications, and it means you need help fast.
Okay, that was all pretty heavy, I know. But here's the good news. Modern medicine has an amazing toolkit for both heading these conditions off at the pass and for diagnosing them with incredible accuracy.
So on the prevention side of things, there are two main plays that have really strong evidence behind them. For high-risk individuals, a simple low-dose aspirin, started early and that's key, before 16 weeks can seriously lower the risk of developing preeclampsia. And in populations where people don't get a lot of calcium in their diet, adding a supplement can also make a real difference. Now for diagnosis. Remember how we talked about organ involvement? One of the classic signs is protein spilling into the urine, which is called proteinuria. And there's a magic number here, 300 milligrams in a 24-hour period. If you cross that line, it's a major piece of the preeclampsia puzzle.
And the cool thing is, doctors have a few different tools to check for this. The old school gold standard is collecting urine for 24 hours, but thankfully there are faster ways now, like spot urine tests or even a basic dipstick. But here's the most important part. You don't need all of them to be positive. A positive result on any single one of these tests is enough to check that box.
And if we look at where things are headed, diagnosis is getting even smarter. Instead of just looking for the damage the condition causes, new blood tests can actually measure specific proteins coming from the placenta itself. It's like a biological seesaw. In a healthy pregnancy, everything's in balance. But in preeclampsia, a protein called placental growth factor goes down, while another one goes up. By looking at the ratio between these two, doctors get this amazingly clear picture of what's really going on at the source. This is the cutting edge happening right now.
All right, that was a ton of information, I know. We've gone from timelines and screening all the way to lab values and biomarkers. So let's take a breath and boil this all down to the key takeaways you really need to remember.
Okay, here's your rapid-fire revision. High blood pressure pops up after 20 weeks. Your brain should immediately go to hypertensive disorders of pregnancy. Protein in the urine? The key number is 300 milligrams a day. Severe features? Think low platelets and angry liver enzymes. Prevention? For those who need it, it's all about low-dose aspirin before week 16. And finally, screening? The modern standard is that multimodal approach, nice and early, between 11 and 14 weeks. Got it? And all of this brings us to one final, really hopeful question. As our ability to predict who's at risk gets better and better, and as our simple, effective prevention tools get used more widely, are we moving toward a future where the most severe complications, things like eclampsia and HELLP syndrome, could actually become a thing of the past? It's an amazing thought, isn't it? And it's what's driving all the incredible work still being done in this field.